Welcome back to Special Report and Common Ground. We are thrilled to be in the Senate Agriculture Committee room with our two guests from both sides of the aisle, Senator Debbie Stabenow, Democrat from Michigan, Senator Roy Blunt, Republican from Missouri. Thanks for having us up here. You're the Senate Ag Committee chair, so we're happy to be in this room. But today you're talking about something different, and that is success on mental health. Explain that and what happened today.
Well, thanks so much for talking about this. This is so important. And Senator Blunt and I have for years led efforts on community health centers, which are a model strongly supported on a bipartisan basis, where you set high quality standards for care and then you fully fund the clinic. But we've never done that on mental health or on addiction services. And so we started looking at, well, how could we do that? And we developed what was called the Excellence in Mental Health and Addiction Treatment Act, which sets high quality standards, fully funding mental health and addiction services as health care in the community.
You're announcing that it's expanding because you're seeing success.
Well, it's expanding. People always feel like we've got to have a mental health system that works better, but we've really never been able to put a model in place that we could prove worked. And we've done that now. It's the last bill that President Kennedy signed into law 50 years ago, now 59 years ago, and it was the Community Mental Health Act. And the goal of that act was to close the big institutional facilities that weren't serving people very well and replace them with community-based, high-quality mental health facilities. And the country spent most of the 70s and even some into the 80s closing those facilities, but very few places offered the alternative. And so this is really back to what's really been a goal for the federal government for 59 years this month. And we had this news conference this morning talking about how the other 40 states could join the 10 pilot states and have exactly what the government said we were going to do 59 years ago.
We are connecting the dots.
And it's even more important now after the pandemic. The CDC had these stats. August 2020 to February 21, percentage of adults with recent symptoms of an anxiety or depressive disorder increased from 36.4% to 41.5%, and the percentage of those reporting unmet mental health care needs increased from 9 to 11.7. And most of these are in younger people, 18 to 29, so it seems like it's crucial at this point.
There's no question about it. What we're doing with the comprehensive clinics is that where they are, someone can just walk in and begin to get the help that they need for themselves or their child or another member of their family. And they're required to give 24-hour crisis services. So
this stems from the Bipartisan Safer Communities Act and $8.5 billion to expand this program. A lot of people look at Capitol Hill and say, this place is broken, it's so partisan, but here you are, Democrat and Republican, and you've worked together for a number of years.
Actually, the first bill, we were both on the Ag Committee when we came to the Congress together in the House 26 years ago.
And what was the first bill?
The first bill we passed was a wheat mold research bill.
Impressive. For some communities, maybe.
It was for some communities.
All right.
But we did it together, and we've done a number of things together since then. We helped found the Federally Qualified Health Centers Caucus. So, you find these things to work together. I think often they don't get the coverage, obviously, that you can get by being really angry about something as opposed to really getting something done. And this is going to make a big difference in people's lives.
When you hear people say Washington doesn't work, do you point to this relationship? You're losing him. He's leaving the Senate.
I'm locking the door. He's not leaving.
Yeah. But here's a senator, and there's a few who work hard to get to yes. It's a lot harder to get to yes than it is to get to no. Are you worried about, the Senate composition?
I do worry about that, and we have other colleagues as well that I have
Senator
worked
Portman,
closely with, Senator Portman on Great Lakes issues and so many other things. I think what worries me the most is somehow this sense of not trusting our country and the way we solve problems in this country, and we need people in government who believe and trust that if you reach out in good faith with people, if you keep your word and you work hard, that you can actually solve problems, and that's what we do.
Sure.
You have differences
Of course.
on some big issues.
With people who've gotten to the United States Senate and have had positions that they've developed over years, it's probably not much use trying to talk them out of that. What you find the common ground and move forward. I do think the country's finally wrapping itself around the need to treat mental health like all other health, to get ourselves in a place in society where you can talk about a mental health problem somebody in your family has just as comfortably as you talk about a physical health problem.
I remember when we used to whisper, somebody has cancer. Yes, cancer. You know, now people talk about their cancer, their treatments, they go to treatment, they come back, they continue their life. We want, in the case of a mental illness, a brain disease or an addiction, to be something you talk about and you say, yeah, I got some help for that.
And you're seeing things work. I think
Yes.
the criticism always about big government is that it throws money at problems and doesn't see actual things work. You're actually seeing things in these states that are making
Yes.
a difference.
In fact, we were blown away. There was a 60% reduction in people going to jail with a mental illness in the communities that had these comprehensive clinics. There was a 63% reduction in people sitting in the emergency room, 41% reduction in people being homeless, and that was after only 2 years.
So as you come to the end of your term up here and your time here, will you look back at these big bipartisan moments as your biggest successes?
For sure. You know, whether it's research dollars we've done at NIH, what we've done here, the efforts I've been able to make as a member of the Intel Committee, all would be among the things that we'd look at. The infrastructure bill that Republicans and Democrats voted for this year.
So are you worried about the Senate after you leave?
No. No, I think the Senate, I think we're going to get beyond this idea where anger is the coin of the realm. And I think this is one example of how much better it is to talk about accomplishment than it is to talk about how terrible the other side is.
You're coming up to an election, and both of you are going to fight for your teams.
There's no question. I mean, I want to be in the majority, and Roy would like to leave with the Republicans coming back in the majority. But there also ought to be a line. You know, there ought to be lines somewhere.
Where that ends and you start negotiating on something.
Right, and sort of also lines in how people talk about each other and campaign and so on. And
last word. You have November 14th to the end of the year. I mean, we're looking for something to get done?
Well, this is one of the things I'd hoped I'd get done this year, to have this concept move nationally. We've got a handful of things that we're working on, and I think going to get done. I want to see our efforts at the National Institute of Health for Research continue to follow the pattern we've been on for 8 years now, and I hope and believe most of those things can happen.
Senator Blunt, Senator Stabenow, we appreciate your time. Thanks for coming on Common Ground.